Thank you all for coming here this evening. Tonight I'm going to inform you all of what is actually a more common issue in our country than I thought. It is called PCOS. PCOS stands for Polycystic Ovarian Syndrome. It is an endocrinal syndrome that affects 10% of all reproductive age women in the United States. That's more than 6 million. It affects women in a number of ways. The first and most problematic being infertility. The other, irregular periods, depression, excessive weight gain despite any diet or exercise efforts, acne, and excess facial hair. PCOS is actually considered a syndrome rather than a disease because it manifests itself through a group of signs and symptoms instead of by itself. PCOS is often considered purely a gynecological disorder, since many PCOS symptoms involve a woman's reproductive system. It is, however, a systematic disorder because it involves hormones, sugar metabolisms, lipids in our blood, and our blood vessels. With these issues, PCOS can also cause more severe problems, such as insulin resistance, or IRS, which puts you at a greater risk for developing type 2 diabetes, heart attacks, and stroke. It can also directly cause diabetes, non-alcoholic fatty liver disease, heart disease, high blood pressure, high cholesterol, endometrial or uterine cancer, and breast cancer. Understanding PCOS is actually easier if one tries to picture what goes on inside a woman's ovary each month. Each month, a woman's ovaries begin to ripen a number of follicles. The amount of immature follicles changes with each cycle, but during a normal cycle, 1 or 2 follicles grow stronger than the others and produces an egg. Then, when we ovulate, the egg in the dominant follicle pops out, falls down the fallopian tube, on its way to the uterus. This is ovulation. But in PCOS, many follicles ripen, they just don't produce the egg. Here is actually a diagram of a woman with PCOS. It shows a normal ovary, which you can see has no ripened follicles in it on a regular basis, and a polycystic ovary that you can see many follicles that have ripened on here. A polycystic ovary actually resembles like it's covered in pearls. You can also see the difference on the ultrasound of the ovaries. There's a lot more open follicles. Unfortunately, PCOS is treatable, that's the good part, but it isn't curable. It can be treated by simply going on the birth control pill, but for women trying to get pregnant, and of course this occurs normally at reproductive age women, so a lot of them are, so that's not always the best option. For the women that are trying to get pregnant and have PCOS, there's an insulin balancing drug called metformin or glucophage that I have right here. Metformin affects the way that insulin controls blood glucose and lowers testosterone levels in a woman's body. So then ovulation can occur and the woman can become pregnant. But of course, the most natural and efficient way of treating PCOS is following a low glycemic load diet, or just eating more enriched, nutritious food and having regular exercise in their day-to-day activities. PCOS is a syndrome that affects over 6 million women in the U.S., but it is an easy one to fix. We just have to live healthier lives, eating healthier and exercising. All we can really do is raise awareness of PCOS in hopes that women everywhere will take better care of themselves and live longer, healthier lives.